Can an old drug that used to be used topically for hair growth be now used orally for the same purpose of hair growth? We're going to discuss it after this, so keep watching. Hi, I'm Mike, the founder of Balance for Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, consider subscribing and leaving comments so we can answer them in our next video. Okay, we're here with Dr. Kryger, a doctor for over 50 years who's also involved in TRT and knows a little bit about some of the use of this particular drug I mentioned, which is minoxidil, which you may have worked out from the intro to the video. And in the latest headlines, there have been discussions, and we've heard this from patients in the past, well before this headline came out, that one of their doctors, they were focused on hair loss, had prescribed minoxidil, about 5 milligrams. Was it daily, or I think daily or twice a day?
Twice daily.
And twice daily, and they found they had a significant amount of hair regrowth, much more than they did by applying a topical lotion or foam, such as from products such as Regain.
Rogaine.
Well, in the UK, it's called Regain.
I see.
That's right. So so just what we want to talk about, just address it very quickly, your thoughts, and if you've had any experience as a clinician, or what you've seen in the studies, and what your thoughts are on this article, that this now relatively inexpensive drug, depending on where you are. I mean, we've looked at the
No,
UK,
it's a relatively inexpensive drug. Yeah. So just a quick primer on hair loss. So hair is being lost continually on a regular basis, and what happens is different places on the scalp respond to different hormones, and while hair loss may be occurring on one area, hair regrowth is occurring on another area. So, for example, let's talk about male pattern baldness. Male pattern baldness is a phenomenon, a hereditary phenomenon, that occurs in men as they age, either by frontal loss with recession along the edge of the scalp, or loss at the top of the scalp. This occurs in relation to genetics plus testosterone. Testosterone, which can convert to dihydrotestosterone, or DHT, affects the hair follicles in the following way. In the areas of recession, the top of the scalp for male pattern baldness, and recession along the edges, testosterone increases the loss of hair. In the areas along the side of the head and the back of the head, it has no effect, because dihydrotestosterone does not affect those hair follicles. And basically what happens is the hair follicles lose their blood supply. In some conditions, like alopecia areata, where all of the body hair is lost, they have recently found that it's related to inflammation that occurs around the hair follicle, destroying it. Now, how does minoxidil fit into this? Well, minoxidil is an old medication that was used for treating blood pressure by increasing the blood supply to an area. So Rogaine or Regain was sold, and the concentration being low enough to sell it over the counter, as a multi-use cure for men and women's hair loss. But unfortunately, it did not work in everyone. And this is because the hormones also play a role. So women whose hair was thinning might get increased thickness of their hair. Some might get full regrowth. But women have a lot more hair to begin with than men. But most, well, again, the figures seem to be for men, 1/3 have regrowth, 1/3 have increased growth, and 1/3 have no change. When minoxidil was switched back to oral use, the way it was used originally for blood pressure control, the effects were much, much greater. As a matter of fact, in alopecia areata, this inflammatory condition, which is largely genetic at first, but then, in other words, it runs in families, but then also response to treatment with anti-inflammatories. Adding minoxidil, 5 milligrams twice a day, increased hair growth by 18%. And this was in totally bald people. Now, people who don't have alopecia areata, but have male pattern hair loss, may also benefit. We don't know at this point. Certainly it's safe. It's been sold on the market for years as a foam, and many people who use it swear by it, and many people say that it's useless. But being inexpensive and at least offering something, since there is basically nothing at this point to regrow hair, suddenly switching back to oral use may be more effective and should be at least tried for a period of time. Again, because of the cycling of hair loss, it would have to be used for at least 2 to 3 months before someone could say, yes, it's helping, or no, it's not helping.
Interesting. Okay. Any side effects or risks from oral minoxidil at that dose?
Well, because it does affect blood pressure has to be monitored. But other than that, there doesn't seem to be anything. It seems to be quite specific in increasing the blood supply.
Okay.
And increasing blood supply is good
yeah.
for any area, much like the use of Viagra and Cialis, which was first developed as a drug for treating heart conditions where blood pressure was too high, and they noticed that the men who were using it had more erections. It increases blood supply. And remember, when blood supply is increased to the peripheral areas, blood pressure tends to drop.
Yeah. So would there be a negative effect if you use both minoxidil and some PDE5 inhibitor like sildenafil? Do we think?
Yeah, it's at this point, because it's just being reused, as you said, an old drug with a new use. We'll have to see, since there are many men who take Cialis or Viagra, may also end up using minoxidil. We would have to see if maybe the effect was too great. Remember, the side effects of these erection enhancers is also flushing and pain in the muscles due to the increased blood supply. Sometimes eye color changes in terms of visual changes, increasing.
Like you can see blue if
yes.
you're on the sildenafil.
So we'd have to see if there's an interaction. But again, if both drugs lower blood pressure, you'd have to watch that blood pressure doesn't go too low.
All right, well, thanks. So, I mean, we'll have to watch this space. There's still data, and it's not, according to this article, FDA approved for the purpose to take in orally for hair loss, but it has been for topical for many, many years, and it's over the counter for the topical purpose. So, again, we'll have to watch the space and see how it plays out. But thank you for your input, and thanks for everyone for watching. So if you like this video and others that we have on the channel, don't forget to watch some of our older videos. There's some good information. And if you have comments or questions, or even comments for Dr. Kryger, please leave them in the comments below, and we'll see you next time. Thanks for coming on.
My pleasure.
All right.